of time, place and person. And based on the epidemiological descriptive study, we formulate hypothesis. Hypothesis means proposition. Probably these factors are responsible for causation of this disease. And this hypothesis is again tested by another study, that is case control study and cohort study. So, case control study and cohort study will test the hypothesis which has been formulated during descriptive study. And another is experimental study. In experimental study, we do intervention, but in analytical study or descriptive study, there is no question of intervention. But in case of experimental study, we do intervention. Suppose one group of patients were given, say, one newer molecule, newer antibiotic, and another group of people were not given any type of antibody. They are given just placebo. So, these two groups were followed, and subsequently we see the result, whether the treatment group had less morbidity in comparison to non-treated groups who are given placebo. Clear? So, broadly the studies are, one is descriptive study, another is analytical study and another is experimental study. So, to do any kind of study, we have to collect data, we have to collect information. So, today's class is mainly the sources of epidemiological data. Sources of epidemiological data. Sources of epidemiological data. What is epidemiology? It is the study of the distribution and determinants of disease or health related events in a specified population during a specified period, and these data are collected to control or prevent the occurrence of the disease. ঠিক আছে? তাহলে এই epidemiological data আমার সোর্স কি কি? এর জন্য বই পড়তে লাগে না। হ্যাঁ? One important source is hospital record. One important source is hospital record. Hospital record. At hospital, patients are coming in the OPD, outpatient department, and patients are admitted in the indoor. So, sources of data at hospital mainly from the OPD and also from the indoor. So, these data are passive information. Why? Patients are coming to you with some complaints and you are noting their complaints, and based on that you advise some investigations, and after confirmation of the diagnosis, patients are treated accordingly. So, based on that, patients are categorized that this patient is suffering from malaria, this patient is suffering from dengue, this patient is suffering from meningitis, this patient is suffering from road traffic accident, like this. So, accordingly you classify these patients, that these patients are suffering from communicable diseases or these patients are suffering from non-communicable diseases. So, these data are passive information, because patients are coming to you at your hospital. This is the passive information. So, what is the advantage of this hospital data? Hospital data, it is easier, it is less expensive, and already infrastructures are there, health personnel are there, computers are placed. So, they are recording this data and they are giving this information at every month to the higher officials, and from higher officials this report will percolate to the State Bureau of Health Intelligence, SBHI, State Bureau of Health Intelligence. SBI, they will compile all these data and ultimately they will send these compiled data to CBHI, Central Bureau of Health Intelligence in Delhi. Central Bureau of Health Intelligence. Why? Because based on these data, government will formulate policies, government will take appropriate measures so as to control the spread of the disease. As for example, during COVID-19 infection, initially there are few cases, gradually more and more patients are coming, and ultimately government had to take various preventive measures. So-called hospitals or PSCs or sub-centers were not well equipped to tackle these so much people who are suffering from various COVID-19 infection and their morbidity and also mortality. So, government had to plan accordingly. Government had to make temporary arrangements for treating these patients and also temporary arrangements for disposal of the dead bodies. So, these data are needed for future planning so as to prevent the spread of the disease in the community. Clear? These are all hospital data. And these are passive, these are the passive information. What is active information? When you are going in the community and you are searching for further cases, and you do house to house visit, and suppose for malaria elimination or control program, health workers will pay visit at every house and they will ask any of the family members had suffering from fever or had an attack of fever in the recent past within last 2 weeks, or any of the family members are suffering from fever at present. So, based on that they will draw the blood, one thick smear and one thin smear. You have been taught why thin smear and why thick smear. Both thick and thin smears are prepared from the family members who have history of fever in the last 2 weeks or who are suffering from fever at present. And these slides are tested at lab, and the laboratory lab technician or the pathologist will give the result whether that person is suffering from malaria or not. After getting the report, the health workers will give radical treatment to the patients who are suffering from malaria. Clear? So, this is the active surveillance or active search for cases. So, these active search will increase the total number of cases. All patients will not come to you. Many patients will go to the quacks or to the traditional healers. এই যে ওজা, ঝাড়ফুঁক এসব আছে না বিভিন্ন গ্রামে, CHG, community health guide. So, many patients will go to the traditional healers because they have faith on them. They will not report to the hospital, or hospital is far away from their residence. So, it is not always possible the patients to come to your hospital, or if patient is serious, then the serious patients may be admitted in an adjacent district in a reputed hospital. So, until or unless, or many patients may die within 1 or 2 days. In case of cerebral malaria, patient may die within 6 hours. So, if you do not collect data by visiting house to house, then many cases may be missed. So, this is the active surveillance or active search for cases. Clear? One is hospital based data, that is the passive data, passive information. Another is active information by doing house to house visit. এটাকে আমরা বলি প্যাসিভ সার্ভেইলেন্স। আর যখন হাউস টু হাউস যাচ্ছি, হাউস টু হাউস, when we are visiting from house to house, This is active surveillance. ঠিক আছে? What is the meaning of surveillance? Surveillance, in short, you remember, this is the data collection for action. It is the data collection for action. Watch over with attention, authority and suspicion, and analyze the data and take appropriate action to prevent the occurrence of the disease or to prevent further spread of the disease. তাহলে hospital based data, this is the passive surveillance, and house to house visit, it is the active surveillance. Next is another source of data, Sentinel surveillance. Suppose many cases may not come to the hospital, they may go to the rehabilitation center. They may go to the rehabilitation center. As for example, in case of poliomyelitis, patients will recover gradually, but patient may have some residual paralysis, and that's why these cases may not come to you at hospital. They may go to the rehab center, which are not always run by the government setup. So you have to keep in mind that Sentinel centers are to be monitored, or Sentinel centers are to be visited for collection of data. And what is Sentinel center? Sentinel means watchdog. Watchdog. Suppose at Kolkata Belekata ID Hospital. In Kolkata Belekata ID Hospital, mainly infectious cases are admitted, or mainly the infectious cases are reported there. It may be diphtheria, it may be tetanus, it may be rabies. So polio surveillance officer, they paid a visit at Belekata ID Hospital. Why? They were missing many non-polio AFP cases. Non-polio AFP cases should be at least one non-polio AFP case per 15 lakhs. Per 15 lakhs population, there will be one non-polio AFP case. So if considering the total population in Kolkata, number of non-polio AFP cases are less. So they visited ID Hospital and they gave training to the doctors and also the health personnel, and they informed that all paralysis cases are to be reported to us, and we will take detailed history and also we will collect stool. So if the stool is positive for wild polio, then it is a pure case of poliomyelitis, but if stool is negative, then it is a case of non-polio AFP. So in case of poliomyelitis, usually patient comes with paralysis of lower limbs or paralysis of upper limbs, but there are some rare presentation of poliomyelitis like difficulty in deglutition. So in case of diphtheria, patient may also complain of difficulty in deglutition. So it is not possible to distinguish whether it is a case of real diphtheria or it is a case of poliomyelitis. So that's why these cases, or patient may come to you with Guillain-Barré syndrome. Guillain means paralysis or paresis, weakness of the upper limbs, difficulty in speech, difficulty in deglutition. So these cases, these Guillain-Barré cases or the diphtheria cases were also included for collection of stool and also detailed history taking. So in Sentinel centers, detailed history are taken, and all the detailed history are recorded, and these centers give additional information. They give additional information. Another example of Sentinel Center is HIV clinic, STD clinic. So, in HIV clinic or STD clinic, many patients will, suppose in case of STD clinic, sexual transmitted disease clinic, many patients may be HIV positive. So, these are the Sentinel Centers where specialized cases are reported. I went to Bangalore in the year 2005 or 2006, and we visited one Sentinel Center, and almost every alternate patients are HIV positive. And I thought that within the next 10 years, there will be epidemic of HIV/AIDS. But at present, prevalence of HIV is less in comparison to previous 10 years back. Why? All the specialized cases who mimic HIV or AIDS-like syndromes were referred to this center, and they were tested, and based on the result, they were diagnosed as, yes, it is a real case of HIV positive or AIDS, or it is non-AIDS. So, all the referral cases are tested here. That is why the report is apparently report is exaggerated. Clear? So, these Sentinel Centers have some criteria. Large number of patients will attend there, and there will be specialized doctors, specially trained staff, and also laboratories will be well equipped, and they will maintain the records in detail. They will record the immunization status, they will record what is the age of the patient, what is the sex of the patient, what is the address. So, detailed reportings are there, and they will be willing to give information, or they will be willing to share the data regularly to the higher officials. So, that is why these Sentinel Centers also give valuable information. Clear? Next is laboratory reports. If you compare the laboratory reports, you will find that there may be increased number of cases, it may be communicable diseases, or it may be road traffic accident. So, if you compare the cases with previous years, you have some idea whether there is a decreasing trend, there is an increasing trend of the disease. In the laboratory, important tests are done like HCV, hepatitis C virus infection, hepatitis B virus infection, HIV infection, or malaria, or typhoid. So, if you compare the lab reports with previous years, you have some idea whether there is an increasing trend of the disease, and based on these reports, the health officials or the planners will plan accordingly, and they will take appropriate preventive or precautionary measures. So, report from the laboratories. Another is cancer registry. As a whole, many cancer patients are not reported to the health center. Many cancer patients will go to the allopathy doctor or to the traditional healer. So, many cases are not being reported at the hospital setup. but in almost all cancer hospitals, they maintain a good register. They will record all the details of these cancer patients, because these cancer patients will come to the hospital for follow-up. Suppose one cancer patient was given for chemotherapy, and after 1 month, patient was asked to report to the hospital, and in this way, they will follow these cancer patients up to 5 years, 7 years, 10 years, 20 years. So, from this cancer registry, you have an idea what type of cancer is more prevalent in particularly in India, whether oral cancer is more among males, whether breast cancer is more in India in comparison to other counterpart, whether blood cancer is more among the children or more among the adults. So, from this cancer registry, we can we get an idea what type of cancer is more prevalent in country, whether it is more prevalent among the males or whether it is more prevalent among the females. So, cancer registry is also an important source of epidemiological data. Next is census. Census, what is census? It is a collection of demographic, economic and social data. It is a collection of demographic. What is meant by demographic? What is the total population? What is the number of male? What is the number of female? What is the ratio of male female? These are the demographic characteristics. So, demographic, economic, what is the socioeconomic status of this group of people, and social data. Social data means how much, what percentage of people are alcoholic, what percentage of people are smokers, what percentage of people are drug abusers, what are the percentage of suicide in the community, what percentage of homicidal cases in the community. So, these are the social data. So, they collect demographic, economic and social data, and these data are to be analyzed and these data are to be percolated to the planners or who need it for further planning. This census is done at every 10 years interval, at every 10 years interval. At the end of first quarter of the year, the health workers will do house to house visit and they will fill up the pro forma in detail and they will report to the higher authority, and after that the government will publish the census report. This census report is very important for calculation of prevalence or calculation of incidence. Why? Until and unless you know the denominator population, it is not possible to calculate incidence or prevalence. In the hospital, few people are coming from Birbhum district, few people may come from adjacent district, few people may come from Bihar. So, there is no catchment area in case of hospital. So, there is no denominator population. There is no demarcation of denominator population. That is why we cannot calculate incidence or prevalence based on the hospital data. Clear? So, if we have some census, what is the total population in Birbhum district? And suppose if we take the example of subcenter, one subcenter is to be chosen in a locality where there are population around about 5,000. So, for 5,000 people, there will be one subcenter, and this subcenter will be manned by not doctors, but by health worker. There will be one male and one female health worker. They will serve these 5,000 population, and among this population, they will suppose health workers reported 2 cases of gastroenteritis, 4 cases of ARI, among under 5 children. So, what is the incidence of gastroenteritis or incidence of ARI? So, you have to calculate 4 by 5000 into 1000. So, it is the incidence of ARI. What is the incidence of diarrhea? Numerator 2, denominator 5000 and multiplication factor 1000. So, it is the incidence of diarrhea. So, until unless you know the denominator population, how will you calculate the incidence or prevalence? In case of prevalence, multiplication factor is 100 and prevalence both new and old cases are included. But in incidence, only new cases will be considered. So, in the month of say March, new cases were 2, that is diarrhea, and 4 cases ARI. So, incidence is 4 divided by 5000 into 1000. Clear? So, these 5000 population is really present in that locality, or there is more than 5000 population. 10 years back, suppose 8 years back, total population was 5000. Say in the village A, say village A and B had a population of 5000 in the year 2016. In the year it was population was 5000, but you are doing study in the year 2024, you are doing study at 2024. So, after a lapse of 8 years, do you think that population is still 5000? Usually, population will increase in rare situation, in hilly area, difficult to reach area, there may be less number of population. People have left the village, so there may be chance of less population after 8 years. But usually after 8 years, it has become 8000. So how this 8000 population? How this 8000 population was calculated? This 8000 population was calculated by SRS, Sample Registration System. SRS, as the census report is published at an interval of 10 years, so we will not get the actual population figure. So, in that case, we can use the data of SRS, Sample Registration System. Sample Registration System, it is done at every 6 months interval. 6 months to 1 year interval, the sample registration system is done. So, they will update the data about the total population. Clear? So, we can get the data not only from census, but also from the sample registration system, SRS. SRS, এগুলো তোমাদের পরের সময় পরীক্ষায় শর্ট নোটে লিখতে দেয়। SRS, census. So, these are the important sources of data. আর কি আছে important source of data? Verbal autopsy. Verbal autopsy is an important source of data, particularly in the rural areas. We are given training on verbal autopsy at Bangalore. What is done in verbal autopsy? The non-medical health worker will collect data from the relatives of the deceased. যে মারা গেছে তার নিয়ারেস্ট ওয়ান যে তার বাড়িতে থাকে তার কাছ থেকে the health worker will collect data. What data? Detailed history at the time of death or immediately after death or within previous 1 or 2 weeks. What was the background history for the death of this person? And if the relative give you the history that the person was working in the field and the age of that person was suppose 60 years and he was hypertensive and he was not taking antihypertensive drugs regularly, and he came back home and suddenly he felt pain in the chest, and within 10 or 15 minutes he collapsed and he died. So, this history clearly indicates that this patient died probably due to myocardial infarction. So, these important history, what are the circumstances, what are the history that was highlighted by the relative of the deceased is very much important for arriving at a probable diagnosis. So, based on this history, you will arrive at a probable diagnosis. Because at village level, many patients will not go to the hospital, or in acute phase, many patients will not get enough time to reach in the hospital. Before reaching the hospital, patient may die. So, if you collect detailed history, then you will be able to arrive at a probable diagnosis. Why this probable diagnosis is important? Because you will inform the community people that these patients may have been saved if the person were advised to take regular medication. Clear? Suppose pregnant woman, a pregnant woman suddenly complained of pain abdomen and there is excessive bleeding, excessive vaginal bleeding, and the relatives went to the traditional healer and he gave some medication, and after 2 or 3 hours the bleeding was not controlled, and ultimately they started coming to the hospital. On the way the mother died. So, what is the probable diagnosis? It is a clear case of antepartum hemorrhage, and patient died due to excessive bleeding, and this death could have been averted if the people were made aware that for all pregnant women you must keep ready for a transport at the time of emergency. So, you will arrange a vehicle beforehand that if there is any convulsion or if there is any danger signs during pregnancy, like less fetal movement, or there is convulsion, or there is excessive bleeding, or there is dribbling of the liquor. So, these emergency cases will be immediately shifted to the hospital for proper management. So, if this pregnant lady was shifted to the hospital within 2 hours, golden hour, within 2 hours, then the life of the mother could have been saved by giving blood transfusion or by doing immediate emergency cesarean section. So, that is why this verbal autopsy is also an important source of epidemiological data. Clear? Next is কি ক্লাস আছে? আর 2 মিনিট, হ্যাঁ, আচ্ছা, ভার্বাল অটোপসি। আর কি বললাম? Environmental surveillance. In poliomyelitis, although there is zero reporting for last 8 or 10 years, like that. In spite of that, swage samples are collected, and these swage samples are tested whether wild poliovirus are present or not. That is the environmental surveillance. Apart from this, there is surveillance of air pollution. What is the level of SO2? What is the level of suspended particles in the air? So, this type of environmental surveillance is also going on. Another is entomological surveillance. Entomological surveillance to control the vector-borne diseases. To control the vector-borne diseases, we do entomological surveillance. Entomological surveillance. Vector-borne diseases means the diseases which are transmitted by the bite of the mosquito or by the bite of the arthropods. What are the important vector-borne diseases? Malaria, diarrhea, dengue, chikungunya. So, these are the important vector-borne diseases. So, to control the vector-borne diseases, we do the entomological surveillance. Entomological surveillance means we collect data whether there is sudden increase of vector density. That means the mosquito density has increased or not. Whether these mosquitoes or whether these vectors are resistant to insecticides. To kill the mosquito, we use the insecticide, DDT hote pare, malathion hote pare. So, based on these reports, we have to plan accordingly. Suppose if the mosquitoes or the insects are resistant to DDT, then we will switch over to malathion, because these insects are sensitive to malathion, but they are resistant to DDT. So, in that case, we will not use the DDT. So, that is why this epidemiological data is also important for planning to spread or to control the spread of the disease. Clear? So, these are the various important sources of data. So, in a nutshell, what are the important sources of epidemiological data? One is census, one is SRS, Sample Registration System data, another is hospital record data, another is active search for cases, another one important is investigation of an epidemic. Suppose if there is reporting of more number of measles cases, particularly from a slum area, more than 5 cases were reported in a month, immediately the special team will go to there and they will collect the serum and they will test whether these patients are really suffering from measles or not. So, epidemiological investigation in case of outbreak will also give you important clue regarding cause of the disease, and also they will tell you why this outbreak is occurring and what precautions are to be taken immediately to prevent the spread of the disease in the locality. So, this is also an important source of data, epidemiological investigation. And another is active surveillance, active search for cases, another is hospital records, another is cancer registry, another is environmental surveillance, another is verbal autopsy. These are the various sources of data which are needed for doing any type of epidemiological study. Clear? So, these are the important sources of data. একটু বাড়িতে গিয়ে পড়ে নেবে।